We're going to be performing an eccentric protocol, which is important for later stages of lateral epicondylitis. So we were working on, we don't want to start with this right away. We started increasing range of motion. We wanted to decrease the inflammation post flare-up. So now as the inflammation is gone, we're going to start with this eccentric protocol.
So with this eccentric protocol, essentially what I'm going to do is have my patient's arm in a fully extended position. I want the forearm pronated, and I want their wrist hanging off the edge of a surface. It can be a table, can be a chair, it doesn't matter. Initially what we'll start with is just gravity. So the first thing that we're going to do is I'm going to have my patient go into extension as far as he can without pain. Now, one thing I'm going to have to explain to my patient is that there's probably going to be a little bit of pain with this, but that's okay, that's to be expected. We're going to work through that. So he's going to slowly go into wrist flexion and let that wrist go down, and we're essentially eccentrically loading the common extensor tendon here. So some important aspects to look at here, and we're just going to go ahead and continue to do that. I want you to go through 10 reps. Some aspects we're looking at here are the load, the speed, and the frequency. We are going to progressively increase the load based on patient symptoms and progression of strength. So we'll probably increase to adding a resistance band when this gets too easy, and then at some point we'll get to adding a free weight in here, doing the same thing, going slow into flexion. The speed of these contractions will increase progressively to more resemble the mechanism of injury, and then also the frequency. The research states that 3 sets of 10 repetitions is the generic formula that we'll use to hopefully create the best response and not overload that tendon.